Good morning and welcome back. Well, there are at least 2.7 million people in the United States with AFib, which is an irregular, often rapid heart rate that commonly causes poor blood flow. Joining us this morning from Gunderson Health System to discuss this condition is Dr. Okon. Dr. Okon, thank you so much for waking up with us this morning. So, atrial fibrillation, AFib, how does it manifest itself in people? What are the things to look for?
That's a great question. So with atrial fibrillation, I think what is the most scary part of it is that sometimes it can be completely asymptomatic and people don't even know they have it. But when it does become symptomatic, people can feel their heart racing, they can feel some chest pain, they can feel some fluttering in their chests, they can have symptoms of heart failure, some dizziness, lightheadedness, and feel extreme fatigue. Those are usually the most common signs. And then sometimes some people don't have any of those symptoms and they can come in with devastating consequences like a stroke because of the regularity of atrial fibrillation and the risk for blood clots forming.
Something I found interesting is that AFib is expected to grow and affect an estimated 50 million patients by the year 2060. And it's something that some people don't even see the signs or symptoms of. What should we be doing, going to our doctor, making sure that we're able to check for this if we're not getting those symptoms?
Well, that's exactly right, Brittany. Going to the doctor where the manifestation of atrial fibrillation can be picked up, like the irregular heart rate, but also living a healthy lifestyle, making sure that our blood pressure is controlled. If we have things like sleep apnea, that is controlled, diabetes, that is controlled, because these are the risk factors that all come together to cause atrial fibrillation. Things like your thyroid function, if your thyroid function is abnormal, that can also predispose to atrial fibrillation. Reducing your alcohol intake, that can also cause atrial fibrillation. So avoiding alcohol, that would be very helpful to reduce your risk for atrial fibrillation.
So you get the diagnosis that you have AFib. You see anybody who watches our show in the morning sometimes will see the drug commercials for treatments for AFib. I guess what is the recommended treatment for addressing this?
The recommended treatment is a variety of medications, including controlling your heart rate and reducing your risk for stroke. So most of those medications that you talk about on TV, most of them are blood thinners. And all those blood thinners are all designed to reduce your risk for stroke because that is the most devastating consequence. Atrial fibrillation is the commonest cause of ischemic strokes. Up to 20 to 30% of the patients in the United States can come in with ischemic strokes just from atrial fibrillation alone. So controlling the heart rate is very important. Being on blood thinners is very, very important. And then when medications do not work, then we go on to surgical interventions to help with the atrial fibrillation. Also, controlling your lifestyle, reducing your weight to a normal weight range. That is also very, very helpful in controlling atrial fibrillation.
Dr. Okon, we appreciate the time. We're running out of time right now, but we appreciate you taking the time this morning to speak with us. Thank you.
You're very welcome. Thank you.